ethnological and cultural exclusions may create privilege and power, resulting in systemic. So I am going to invite Corenia Smith and just read a short bio for Corenia. So with a background in nursing and a passion for reproductive justice, Corenia skillfully operates at the intersection of policy, politics, and health equity. Her professional experience is deeply rooted in organizing. She embraces the spirit of grassroots power. Corenia's mission extends to helping organizations navigate multifaceted challenges of our time, such as practical work organizing, and facilitating convenient. Can you give us a thumbs up if you can hear us okay? Yeah, there we go.
All right. Yeah, you can spotlight me if that's helpful.
And just put it on the top right.
Yeah. Cool. Throughout this presentation, I'm kind of gonna just share again a little bit about this particular project, the Bird Justice Collaborative, which touches on all those things. And then towards the end, I'll also kind of speak on how I got involved in it, what was my path to that work. And then throughout, there will be instances where I kind of integrate other people that are part of this project. So this is very fun.
My name is Corenia, and I'm excited to tell you about a coalition on a mission to advance maternal health and well-being for Black and American Indian people and their communities. It's called the Birth Justice Collaborative, or BJC, and it was launched in August of 2022 when 4 Black and American Indian-led organizations partnered with Hennepin County to engage their communities in co-designing strategies to improve birth outcomes for Black and American Indian people. My name is Corenia, and I'm
Okay, perfect. So when we started doing that in our first year, our main objective with Hennepin County was to create an implementable plan that would address the maternal health disparities for both African American and American Indian communities. Our intention within BJC is that while we're focusing on specific communities that are experiencing the highest disparities, that our work is actually replicable, that we're using the theory of convergence, knowing that you know, what lifts these boats will lift all boats, and ultimately create solutions that other communities, other issues that folks might be experiencing can be replicated and modified to meet their needs too. So in our first year, we engaged over 300 community members to really hear what are the practices, what are the things that haven't been tried because it hasn't been in the hands of community to actually address these issues. So we started with 2 cultural community convenings and then an intercultural community convening. And part of that was also being really intentional about reducing, demystifying the narratives that folks have around doing cultural community work. Sometimes in cultural communities, there can be lateral violence, meaning that there's not enough money. So, you know, folks are competing for those same resources, meaning that sometimes there's trauma and there's unhealed tension where communities don't want to work together because we're all hurting in our own ways around the disparities that we're experiencing, but those disparities look the same. And so how do we actually work together and pool all of our resources to have a bigger impact? So that was really intentional. We then took those themes and that knowledge and created a leadership coalition where we brought in systems folks, where we brought in other community members to participate and actually coalesce a strategic strategy to address disparities. From there, we had a couple iterations where we looked at, okay, here are some 5 strategies that are emerging as priorities. We're going to bring that back to community, make sure we heard from them correctly, that we captured it well before we move forward and submit that. So out of that came the BJC. And really, when we submitted this to the county, you know, it's a 1-year initiative. We thought, okay, our work is done. The county's going to implement it as they always do. And the county actually said, this looks amazing. You implement it. We're going to keep it in the hands of community, which is pretty different in terms of how those local government community partnerships can actually work, right? What it looks like to actually share power and resources in a really real way. So BJC formed, and again, our main mission is to collectively advance maternal health and birth justice across those communities, and we now have 6 partners, kind of like a board or a steering committee that guide our work. That's the Division of Indian Work, Cultural Wellness Center, Liberty Northside Healing Space, Minnesota Indian Women's Resource Center, Robert J. Jones Urban Research and Outreach and Engagement Center at UROC, and Cultural Wellness Center. And the way that we have also thought about our work is, you know, we look to incubate work, to collaborate on implementation, and really the key of it is to movement build, to tell stories around how to actually integrate culture to resource, realize, and replicate our work, as I spoke to before. So why is the work important, right? Why is it that we need to come together? So we know that in Minnesota, overall, folks talk about Minnesota being a really great place to live. Folks have really great health outcomes. But then when you disaggregate that data, in Minnesota, about 60% of pregnancy-associated deaths occur between 6 weeks after pregnancy and 1 year postpartum. And the Minnesota Mortality Review Committee deemed those deaths as 100% preventable. And so when we further disaggregate that into cultural communities, we have poor outcomes in the African American community, which is 3 times more likely to die from a pregnancy-related cause, and 8 times more likely for American Indian communities. And again, this is data from the Maternal Mortality Review Committee. Their most recent data, I believe, went up to 2017. They'll have another report coming out this year to kind of catch up on that. So when we're looking at pregnancy relatedness, when it comes to deaths, we have about 25%, which is pregnancy related, and about 68.8%, which is pregnancy associated but not related. And that difference is here. So pregnancy related is kind of like those clinical interventions when we have postpartum hemorrhage, embolisms, hypertension, infection, hemorrhage, all those things. And pregnancy associated, not related, is where you have substance use disorder, you have domestic partner violence, suicide and homicide, accidental deaths, motor vehicle accidents, right? And so I think that it's really helpful to think about what are all of the factors that these communities are looking at, do they deem preventable in the period in which they're happening? So from that, we have our 5 strategies. Those 5 strategies are these circles in the middle, and then we have initiatives that live within each of those. So we have address and acknowledge the impacts of racism, which is where our postpartum support pilot lives. And I'll talk a little bit about each of these and some of the lessons that we've been learning from them. So we have a postpartum support pilot initiative. We have advocate for a shared policy and payment reform agenda, invest in a network of cultural trusted providers and resources, support culturally meaningful workforce pathways, and support a coordinated system of anti-bias accountability. So our postpartum pilot is actually going to be wrapping up relatively soon, next month in June, which we launched last year in partnership with Johns Hopkins because we're using a family spirit curriculum. And I will say, like, this is one of many exciting initiatives that we launched, in particular because we're looking at what is the impact of having home visiting support along with cash resources. So we don't call it a guaranteed basic income pilot because people have feelings around how we term things, what we call things, right? And so it's cash resources. And this is led by both Division of Indian Work and Cultural Wellness Center in terms of our partners who lead it and implement it. And participants get to be a part of a 15-month-long postpartum pilot. Participants are 3 months postpartum to 6 months pregnant. And we were really intentional about having that be the window because we wanted to allow for people who could participate in this program to have better nutrition, to seek perinatal and prenatal support if they haven't, to be able to leave a domestic violence situation so they have more financial stability, to be able to really prepare for welcoming a new member to their family. We have $800 each month for the first 12 months and then $300 for the remaining 3 months as a transition. And again, we use the family spirit model because it holds culture. It's currently used in Minnesota at several organizations that primarily focus on home visiting in both African American and American Indian communities. And families also had access to other resources, diapers and CSA boxes, etc. So what we were looking at in particular were these pieces in terms of our evaluation. Postpartum well-being and mental health, measuring anxiety and stress, financial well-being, looking at their ability to pay for basic needs and food security, and then looking at their confidence, looking at the perceived control that they have over their life, as well as their confidence in parenthood that first year after birth. So we had 42 folks participate in the pilot, and then we also had a comparison group. We really had some thoughts around the comparison group initially because we want our evaluation to be as rigorous as it can be. We want to be able to demonstrate the efficacy of it, and we want to be replicable. So we ended up ultimately having a comparison group and just letting folks know, we know that research has done harm in communities and sometimes can be extractive. And so we, in our comparison group, have a comparison group that does not receive the cash resources, but receives home visiting, and then a postpartum group that doesn't receive either. And that was kind of how we set that up. And then as they go, they have focus groups as part of the evaluation, and our comparison group just lets us know how they're doing via some surveys that we've designed. So what we heard from folks around some of the combined support is that parenthood is really challenging, right? No matter who you are, no matter if it's your first child or your second or third or fifth or 10th. And there's a lot of ways that families would like to have support to be able to be set up to thrive. The combined support around their mental health, their well-being, and giving those lesson plans so that they can feel confident and knowledgeable really made the difference. This is from one of the participants, a quote. So especially with my breastfeeding, was able to get a lot of support and kind of just stopped questioning myself and just kept trying. That reassured her that it's not open until the time comes. Even if it's gone, there's a chance that you can get it back. So just learning about lactation, what does it look like to breast or chest feed, and how it's a journey through it, even though there might be media or other ways that we think that people will just lactate. It's a lot of work. And so that was really helpful for this person to continue that journey. For mental health support, the home visitors play a really critical role. We were really intentional about training doulas as home visitors. So everyone knows and raves about doulas. Doulas are incredible. I'm also a full spectrum doula. And we decided to train them to be home visitors, which are very different things, so two different scopes of practice. So they went through some very rigorous training to become home visitors, and part of that was because doulas already carry a continuity of care when they're working with families, but also if we were going to have pregnant families, we wanted them to be able to have the same visitor who was there prenatally, pregnant in pregnancy, also through that whole first year postpartum, to really have continuity of care. And that kind of went beyond both of those roles. Typically doulas do just a few postpartum visits, and typically home visitors are not with you until you actually have the baby. And so they are able to have long visits, really establish getting in touch, and have really in-depth lesson plans that covered newborn aspects, postpartum, and parenting. And one of the quotes here is, "I was really frightened of every little thing that was going on in the hospital world." This is from a partner. Every time something beeped or anything and she felt pain, I was really nervous, but the doctors and her doula really helped calm me down and talk me through everything. And her doula and home visitor always made me feel better and calm because they reassured me that everything was going to be okay. So again, when families don't know what's going on or they're having a new experience, how are we able to empathize and know what needs that they have at that moment and be able to meet those needs as best we can? And part of that is also just including them. Let's see here. I think I'm gonna skip that one. This one here is around confidence in parenting, and really just people are parenting and they're on their own journey. And I think it's really important that one of the pieces that we took from this is that simply delivering the information wasn't enough. It isn't enough to just hand people those pamphlets or those books or the resources, but actually giving them the same, it doesn't have the same effect as in-person lessons. And that's really what made a big difference. The length, the frequency of those really helped them feel supported. They were really able to interact and ask the questions that they needed to get the help that they needed. And to also allow their home visitor to identify, oh, there are other needs happening. I can create referrals. I can connect you to other resources that otherwise wouldn't be happening if we just gave them information. Okay. I think, yeah, the last piece that I'll share on the postpartum pilot, because I'm going to talk about the others, just the whole family support. I think folks are starting to remember that dads and other caregivers and other types of families are a part of the whole family unit. That might be grandparents as well. And so the program is really beneficial, not just for the birthing person, but for the whole family. And fathers also mentioned that. And so that looks like a lesson plan happening in the living room with mom and baby and their home visitor, but there's a grandpa or a dad in the kitchen who's also listening, right? And I think that that also makes sense for a lot of families where, you know, support is shared. And so we want to make sure that they're getting the same information so we can actually help in that postpartum recovery period. Okay, I'm going to share another video as we transition to the next initiative.
When we talk about babies dying and we talk about mamas dying early, we're actually talking about also the destruction of Black families and Native families. So when we look at a systems analysis of what that means, it is exponential, it is complicated grief, it is lack of opportunity, and all of those things are directly tied into the inequity of racism.
Fortunately, a movement is building to advance birth justice for American Indian and Black people in Minnesota.
Okay, so this next initiative is Home Place, right? We don't just have the health that we have without historical context. And we know that the health that people experience, 80% of that happens outside of clinics and actual healthcare systems. So for the Home Place initiative, they're really looking at how to provide wraparound support to the families that participate in their pilot initiative. This is based on the north side of Minneapolis, and their vision is to bring forth a home place in an ancestral way through a holistic retreat center for birthing families in North Minneapolis at Liberty Northside Healing Space. So when we were engaging with the community at the beginning, we heard that this is one of the resources that community would like. And we also heard from doulas who are often independent contractors or sole proprietors who are out doing all their births on their own. They also wanted a home place. They wanted a place where they can go and have consistent educational classes, debrief with other doulas, have access to printing, but just not be out on their own, providing the support that they do for community, because sometimes our healers need healing too. And so there's a couple of ways that they are designing this Home Place initiative. One is to connect the felt sense of connection and healing and belonging to really reduce stress, provide protective cultural factors. So therapy, group lessons, cultural connection, and monitoring and supporting that well-being. They also are looking at practical support and knowledge, so culturally rooted approaches to learning about early parenting and postpartum support. Sometimes there are parents, and this has been validated in the postpartum group as well. If you don't have the experiences or exposures around how you want to parent or what parenting looks like, you only know what you know. It takes a lot of work for folks to go out and find other resources and other ways that they might want to choose to do something different. And so being able to integrate cultural practices in their parenting has been super helpful to learn what they maybe didn't learn before. The other is reducing impacts of economic hardship. So this pilot program also has cash support and resources, and they receive financial and economic counseling on that. And then lastly, there's pathways to trusted providers. So they connect with responsive providers for the Home Place participants. And that looks like ceremony, passage of rites, ways in which they can really be integrated in their community and culture. And this is one of the quotes from a Home Place facilitator. So I feel so helpful because I've received so much support from the staff at Home Place and my doula through Home Place. We've been provided with incredible support, including access to a therapist, financial advisor, a doula, and other birth and family resources. Home Place also provided financial support before, during, and after birth. We don't know if we would have been able to afford all the resources and support Home Place has given us on our own. And then the next initiative here is around the American Indian Birth Center. So when we first started conversations around the American Indian Birth Center, one has not existed, but they're very close or have currently launched an American Indian focused birth center in New Mexico. So maybe we'll be the second. And I think, when we initially were talking about this, a lot of folks know the benefits of birth centers. The outcomes that they have are significantly better for when compared to hospital births. And particularly for the American Indian Birth Center, it was one of the places where they felt like they would actually be able to have a focused center that also provides wraparound support and resources that looks at birth as sacred and as ceremony, and is really able to hold all the cultural practices that they want to integrate into their birthing practices. Whereas in a Western context, birth and pregnancy is looked at often as a medical complication that we need to fix for someone, even though it's a very natural process, right? And so it's a place where they can interrupt bias, racism, and some of the historical harms, improve the birth outcomes and birth experiences for families, and also include family members and cultural healers in that birthing practice and resource. This would also be an opportunity to increase payments for culture providers that reflect the true cost of addressing the impacts of racism. So this is currently under works. The team did an initial year of community engagement around what are some of the services that they would want at a birth center. Minnesota has over 11 tribes that are recognized, and then other tribal communities as well. And in trying to figure out exactly where this would be, when it will launch. And so some of that work is underway, and we're really excited about it. Let's talk about that.
With initiatives like the Birth Justice Collaborative, we can start to say, this is a collective experience, and these are our solutions about how you can change your practice. And one of the best ways to do that is for systems to realize that they're accountable for the structural racism that they perpetuate at the point of care.
That's why that birth center is really important. Okay.
With initiatives like,
Okay. So that's kind of like a little bit of a overview of all of them. The last thing that I'll touch on is just policy. So again, those political determinants of health. Policy actually also impacts our health and shapes our lives. Both the American Indian Birth Center and the African American Home Place both got pre-planning dollars from the state legislature last session. And the Home Place team is currently slated to have an appropriation this year for implementation. And I think that it's really important to make sure that our policies are aligned with our values, that our policies actually support and address the underlying issues that families are experiencing. A couple other policies that the BJC worked on this session, so are currently slated to be included, was addressing midwifery care. So we did some administrative work last session, and so I should say like I'm a lobbyist. So part of our policy team in doing that, and looked at how do we have home birth coverage through Medicaid. So that, if people want to have a home birth experience, it's not just for people who have health insurance that can cover it or have the privilege to pay out of pocket, but that it's an opportunity for everyone who's interested in that kind of birth experience and practice. So with that getting passed, we then looked at the reimbursement rate. A lot of our birth centers have been closing in Minnesota, and part of that mainly is because of financial sustainability. So the reimbursement rate for birth centers for all folks who deliver birth, catch babies, the professional fee is pretty low. But the reason birth centers are closed is because they aren't able to bill a facility fee like hospitals do. So for instance, I'm kind of making up this number a little bit, but you can find it, so it'll be really close. Anyone that catches a baby as a provider, they are able to reimburse like $1,300 for catching that baby. But a hospital is able to bill $13,000 for facility fee, right? And so it offsets those expenses, whereas a birth center can't do that. And so that's why a lot of them have been closing, because it's not really sustainable in their practice. And so we're looking at starting with home birth midwives. How can they have a facility fee or a supply fee that really helps accommodate the fact that they're driving? When birth centers are closing, they're then covering, up to 200 miles over 2 hours in terms of the range that they service or the areas that they give care. That also accommodates for the medications that they bring with them to make sure that births go well. And so that's one of the bills that's currently been slated. The other one is that birth centers are advocating and currently are slated to have 100% the same facility fee as hospitals, which would be huge. And so that is very exciting as well. There are a couple other initiatives, like there's a new certification for certified midwives. So currently Minnesota has certified professional midwives. There's a new path that's being created, should it go through at the end of session, for certified midwives, which is looking at if someone doesn't have a nursing background, how can they also look at becoming a certified midwife? So you can look into that, should that pass. And I wanted to mention that just because all of our initiatives are touching on all social determinants of health. We're looking at addressing the physical environment, housing and domestic violence, social determinants of health, like community engagement, some of the social supports that they might need, food and nutrition, economic stability, education, and healthcare system outcomes. I think this is my last video. Actually, I have two.
Having partnerships between the systems and community-based organizations is crucial. Systems can't do it on their own. Community-based organizations can't do it on their own, but together they can. And in those instances, which are many, where we can't have a Black doctor or an American Indian nurse, at least we have the community-based supports to be that bridge, to be that cultural bridge, if you will.
Okay, so then a little bit about how we're organized. So again, I shared about our partners, like our steering committee, and I'm currently serving as a director. And we have a coordinating support team through the Collective Action Lab, which is a business. And so we're fiscally sponsored by the Minneapolis Foundation. And there we go.
And so we need everybody around the table, because it's not just their gifts, it's your gifts. What do you have that you can bring wholeheartedly to the table, knowing that no one is perfect? So if you think you're coming into a panacea, don't bother. But if you're coming willing to bring everything you have for the next generation, please come. We need you. We need you. Please come.
So what BJC is and what we're not. So BJC is a catalyzer and a coordinator. we actually don't do direct service. We do a lot of the initiatives through our partners who have their own whole nonprofits that do some of that work. But it looks different through BJC because we're piloting new ways and new innovative solutions to how to address the issues. We're the incubator for some of those new models and policies until they actually find permanent homes. So some of our partners eventually will hold those initiatives if they want them to continue. We're not an organization that operationalizes or runs long-term programs. And then we're a community-led collaborative. So again, that governance structure is defined by our partners that's then supported by the Collective Action Lab, which is coordinating support and our fiscal sponsor. So we're not a separate nonprofit organization or even a legal entity. We're not an independent existing thing. So again, when you're talking about partnerships, right? Our partnership with the county, our partnership with our partners who guide our work is really critical to the work that we do because we live within an ecosystem. And so none of our work exists on its own. It's a part of a larger whole. And our priority is really to align our expertise and with experience to amplify, partner with, and enhance what already exists. And only where there's gaps are we actually creating new work. So this is how to stay in touch with me. And then a couple other things I'll just say about my own background and experience as Nick kind of spoke to. So my background is in nursing, sexual and reproductive health. As a full spectrum doula. And I really found myself at a period where I love all of the work and it's really come full circle for me. And sometimes I identify as a generalist. And it's amazing when I get to meet other folks who are coming into public health work because it doesn't have to look any just one way. And I remember when I was starting my schooling, I felt like I wanted to do a little bit of this, a little bit of that, and all those things. And especially in nursing, how many of you in here are nurses? Are you all social workers? Okay, cool.
Social Some nursing and medical on the Zoom call.
Nursing, maybe some of this translates to social work, you're a cohort, so you really kind of stick together and there's not a lot of variation in terms of what those electives look like. And so I really feel honored that I got to have an aspect of nursing school, but then also got my master's in advocacy and political leadership, got to lobby. There's a lot of work that happens in health and human services at our capital and within our states and generally. And I think that, being able to bring all of that to collaborative initiatives. And while I'm speaking particularly about a maternal and infant health initiative, it touches a lot of different issues, right? If food or housing stability or transformative justice and incarceration is your issue, or if you're looking at, homelessness or substance abuse or any of these things that touch any of the people that you might meet in your lives or in your work, there's so many different ways, again, to utilize all of those levers to actually create some change and impact them in really good ways. So just wanted to share that as well. And to just consider that there's lots of paths that you can use, and that while this might be the foundation, you might stay in social work or in nursing all your life. You might use these tools and some amplified ways to do some innovative work as well. So I'll stop there and open it up for questions. The interactive questions that I had were really just kind of checking in with you all, how you're doing as the semester is coming to an end, as summer has arrived. How are you? And then I'd love to hear maybe like a takeaway that you are leaving with, and then questions. So folks online, folks in the room, how are you doing? What's the takeaway that you're maybe leaving with? And this will be like a popcorn style, so. Yes.
Yeah, I don't see any yet.
This comment, but now the sun is shining, so I was like, when the sun is out, I do not want to do it much as well. It's tough, but okay. And the key takeaway is just the collaborative aspect of this, and I really appreciate the cultural aspects that are put into these programs. I feel like that really does make a difference because me and Sophia have our internship at MyAct, Minneapolis and so we see a little bit of that, but to see it in this way is just really cool. So.
Yeah, that's an awesome space too. Glad you're able to be there.
Okay. How am I feeling? I'm feeling very similar to Jazz. A little stressed. There's a lot happening. I wouldn't say I'm like worried about anything. It's just a lot, and I'm not good at scheduling. So like, anyways, I'm trying to work it out. Anyway, so what I took away from this was really just how expansive your program is and how it really kind of takes on every process of the birthing process. I really appreciate with just like, when you're actually getting birth, but before and after, making sure that they feel seen and heard. And I had a friend who was a doula, and she was a Black woman who I lived with from the Omaha tribe, and she was telling me a lot of stuff that you told today, and I was just like, just made me think of her. I was like, wow, like, and I'm like, I don't know, it's maybe more interesting when you think of her. And I like,
Thank you. How about you? Did you have your hand up before?
Oh,
Behind you.
I didn't.
What's
but
your
I-
name? Oh, no, it was the person behind you.
Oh, me.
Yeah.
Oh, hi, Stacy.
Hi, Stacey.
Love the presentation, just coming from class, but, I did have, I guess a few this
Yeah.
prompted a question for me, just from hearing different stories, especially from Black women specifically, my mom's story, all this really resonates with me, even my friends' experience with, opting to choose a birthing center.
Mhm.
And I'm just curious because I'm just hearing the statistics and everything regarding all of this. I'm still at a loss to see why insurance does not provide coverage for this and why this is something that we're still struggling to get coverage for. I don't know if there are any answers to that. but
Yeah.
I'm just.
Any specific aspect of what's not covered? I have an answer, but I want to make sure I'm speaking to your specific.
I guess there are so many more fees if you want to give birth, and I guess in a non-traditional way per se, and have just something that's more inclusive in terms of care and focus specifically on the patient per se versus a hospital setting. And I was just curious as to why, because this is my assumption, they're saying it's risk. There's more risk involved, and I don't know, I'm just curious.
Okay, yeah. Let's see. There's a couple things in there, and I will say billing itself is a rabbit hole once you start to go down it. And I'm not a billing expert. I would say there are a couple pieces of this, and this is something that you all might also encounter, social workers, in terms of risk assessments and what's the real situation happening with people that you encounter as well. Healthcare is really on it's a spectrum and a variation of what's normal, right? So it might be normal for some families to have multiple births and really big families back to back. And our healthcare system might say, you should slow down, you should let your body recover. Why so many babies? Or right. And then you have the other end of folks who struggle to just have one, who need, fertility treatments, and who don't have the education around how their cycles work, because we're not taught that either. And so I'm using those as examples in terms of what does risk look like when families have a vision of what they're looking for in their healthcare experience. We should try our best to try to meet that. And again, even in the context of being a social worker, working with people in their homes or whatever the issue is that brought them to you, there's a variation of what normal looks like for them that often can be counter to what the dominant culture of Western medicine looks like. So that's one piece, particularly when it comes to birth centers. The history around birth centers, most of the country used midwives to give birth way back when we had granny midwives. And then came the regulation and industrialization to move towards hospitals. And that was really rough, that transition, where practices for people, I don't know if anyone here is also a doula, but you learn about how people gave birth and how they would be strapped down to beds and how they were given medications that would just knock them out, right? That's not how we want to give birth, and we want to get as far away from that as we can. We want to also look at our schooling, right? Those are two different theories of thought around how you give birth and what risk looks like. For midwifery care, again, it's a normal physiological process for giving birth. Within a medical context, you're trying to crank that baby out because you need that room. Those are two wildly different experiences. There is actual risk when it comes to what's in the scope of practice for those licenses. Birth centers can only have what's deemed normal And they have explicit criteria for what a normal pregnancy and birth looks like to be able to birth with a midwife. And of course, you have advanced practice nurse midwives who can be with you in a hospital, sometimes also out of hospital. Most of them work in hospitals. And then you, also have real situations and needs where hospitals is the best place for people to be. And in terms of insurance coverage, it's a business. And I think that there's a lot of advocacy to continue to advocate for having the coverage and access. So again, it's not a point of advantage or privilege, but people can actually have a way to achieve the outcomes that they're looking for.
Thank you.
I hope that spoke on it so a little bit. And again, we're digging down the rabbit hole around Medicaid coverage. What does that look like? There are paths like 1115 waivers, which is a federal policy that folks can implement in their states to demonstrate and kind of pilot a service that they think Medicaid should cover. There's a way that folks can look at doing that too. I'm sure there's other ways too. But yeah, now bring questions. Any other questions before folks transition? Yeah.
So, thank you. Like almost every speaker that comes in, my brain is, I've got lots of things I'm thinking about, and just in how you answered that, I was thinking about the parallel space, healthcare education, and when you said cranking out, right? Like it's a business and how some of these culturally responsive initiatives are really counter to that business aspect, right? And it has me thinking just about education and just some of that same thing, right? Like how have we taken what it is to educate and turned it into something that's removed just from like how we learn and how we live and how, and how can we, do something differently, right? Be a little counter, cultural or whatever to that. You had used, and I think it relates to this a little bit, you had used the term catching babies a few times. And I think I caught you at one point using a different term and then almost like stopping yourself and going back to say catching babies. I could have been wrong. I'm wondering if you could say a little bit about catching babies as a way of talking about birthing in relation, I'm assuming in relation to what your, the collaborative here is trying to propose as well.
Yeah, so there's a lot of different providers that we can encounter in our healthcare practice, and in particular when we're looking at birth. And I think I was especially thinking about those licenses, right? So I won't exhaust the list, but you have certified midwives, you have nurses, you have nurse midwives, you have providers, as in typically your OBGYN, who catch babies, but not all of the spaces are you actually catching babies. So sometimes you have side-by-side care where it looks like a birth center, but there are actually live births there. So no one's actually catching babies, but you still have all your prenatal care with a midwife. Or you might have people who have multiple licenses, and so it depends on the scope of practice that they're actually practicing in, whether or not they're going to catch babies. And in particular for the birth center, we hope to ramp up to a point in which we're catching babies, but it might be a birth center that launches without catching babies initially. And in particular, because a lot of American Indian, particular to that population, it's a small population, but they're a high percentage of, it's a small population that is giving birth, but they're a high population that is experiencing mortality and morbidity. And so there's also a high percentage of them that actually would risk out of a birth center birth that would be deemed high risk. And so how do you actually provide that cultural support and everything else that you can do, even if you can't catch those babies? So that's kind of why I'm thinking of catching babies or not in the context in which people might be getting services, because it's really just being specific. Is someone going to catch who's catching the baby exactly? And that might be similar to, you have a primary care provider, but they might refer you to someone else who's going to actually do a very specific procedure or give you specific care. And that's kind of like that nuance. Yeah. Thanks for asking.
Anybody else? We do have a few minutes. We do have time.
We do. I'm curious, what are some of you looking to do, or what are you learning in your internships that might influence and inform what you're looking to do after you graduate with your social work degree? How are you gonna be of service?
I'm Rachel. And, I would say right now I'm in a hospital setting, so my place was at the hospital. And first, I'd just like to say, like, I really loved how you're talking about, like, the continuity of care that you guys prioritize, especially with the healers and like having that consistency of care. I often think about like the patients that I work with and like how it's like, okay, like we discharge them, I gave you some pamphlets and hope it's good, you know?
Yeah.
And so just hearing that was really cool. And I think in my time at the hospital, I found that I value a lot of like kind of more one-on-one long-term relationship building. So like, once again, hearing that concept is where it's just sweet, especially as, yeah, I'm trying to decipher what I hope to do. So
Absolutely. It's a really big factor in trust, and especially even with some cultural communities. I do a lot of work in the Native community, and having a consistent person that they know that they can go to, that can be a resource that they built a relationship with, helps them also tell people that they encounter in community, hey, I know this person. I can, reach out to Rachel. She'll help you find the resources or get the help that you need. That really goes a long way. And thinking about, again, how you can have that impact and actually be of service. Yeah. Thank you for sharing. I'd love to hear from others. What are y'all gonna be up to?
but it sounds like I'm likely to go to school for work after my master's program. Because there's a high need for that, so looking forward to that and just kind of experimenting. I'm hoping next year I get an internship with Nice Women Associates, which is more therapeutic. So they're different fields, and that's what I'm kind of looking at right now, but really not sure.
That sounds amazing and also very complimentary. I know there were points in my nursing journey where things didn't seem like they connected, but they very much did for me. So I would also say, like, do the things that you're really passionate about, because there's a lot of transferable skills. There are lots of ways that you can make yourself unique, provide unique services because of the experiences and things that you're interested in, especially in a school setting. Having a therapeutic background and skills is huge, and it's definitely a growing need in our schools in terms of our young people. Thanks.
We do have some policy folks in the room who are interested in some policy things.
Do you want to share?
Sophia's got interest in.
And I'm really interested in policy work right now, but it's like this whole circle of like, I want to do families and circle back to policy. And then education's really interesting to me, so I'm just trying to narrow down like what I really want to do in the long run.
And you're a social work student.
Yes, ma'am.
What do you want to do with policy?
I really would like to work specifically with like human trafficking and that realm of policy. The policy's still kind of new to me, so I'm just still trying to learn all the angles of policy.
Absolutely. I think that's really exciting. There are some task forces that have been put together around human trafficking. There's of course the Missing and Murdered Indigenous Relatives Task Force. There's also the African American Women and Girls, Missing and Murdered Women and Girls, and that's new. And they just had their first day on the Hill just this year, actually in April. And so I think, following along, seeing what they're up to in terms of how they also integrate trafficking into their work is something that can also help refine or give you some clarity around what that can look like. Yeah, definitely a huge part of family aspects, right? A lot of what we have seen is it's often people closest to folks that are involved in how folks end up getting trafficked, and social workers might be some of the first people that might see some of those situations or those red flags. Yeah. Anyone else that hasn't brought their voice into the room who wants to say something or has a question? I'm looking at you. If the shoe fits though, if you want to say something else. Go ahead.
Yeah, just to talk about what the others have talked about, I'm looking at going to like probably rehab or corrections, potentially kind of social work. Before this year, I was so set on doing school social work, but after like doing some tours and doing some like rethinking, I want to like work one-on-one with people especially, and just like be that level of support, be direct support and care for people. So yeah.
That's amazing, and that's hard work. Social work isn't easy work inherently, and particularly the environment and the context that you do it in makes a huge difference. So I think you should always all think about what are your self-care practices going to be? How are you going to make sure that you're filling your cup so that in those moments where it's hard or you feel drained, you're getting replenished too. And thank you, because we're needed everywhere. So
It's really cool to hear you talk about the historical knowledge and understanding of when it came to research and other sorts of things, and just knowing Preston you a little bit, like those sorts of just when those words are spoken, like it is this intersection of interest, because I know you have a historical interest as well, and the role history plays in how people show up today, and what we're learning as a society, and how that influences how we need to, continue talking to people. So I heard that and I was like, oh, that's kind of cool. That's what some people need to definitely hear. Just want to encourage everyone.
I'm gonna come to this person too.
Yeah.
Zoom.
So this is,
Katrina, do you also want to just name a question and or what you're gonna do after your social work degree?
So I'm a
you know
certified
what? I
nurse.
probably have you, hold on a second, Katrina. So Katrina's a faculty member with, let me unmute you here. Okay, there you go, Katrina.
Hi, I'm a certified nurse midwife who's been in birth centers for the last 12 years. I think they're amazing, and it's so fun to see you highlight them. So I really appreciate that. Bethel has a nurse midwifery program. I'm currently the program director and have been with Bethel's nurse midwifery program for the last 10 years. And I'm transitioning off this summer, actually. But I'm so glad that you're here and highlighting this super important work. And my big takeaways are jotting down some community organizations where I didn't know what they were up to. So I'm going to check them out and add them to my resource list.
Amazing. Thank
Yeah.
you for being here.
Yeah.
Just want to encourage people, again, take a screenshot of the stay in touch. This is truthfully, this is how my life works. This is what happens. Okay. I say to you all the time, have your news sources, right? Like get plugged in, be aware, read the news. I didn't know Corenia, probably a year ago I knew Corenia, but 18 months ago, I didn't know Corenia. I had no idea what the Birth Justice Collaborative was. I read an article. And I read an article about how Senator Kunish, who came and spoke with us last year, if you remember, she was in prime time. She represents, she's the state senator for the community I live in. So I saw her name on a headline. She may have shared the article, which is then why I read it. Oh, what's Senator Kunish up to? I read this article about legislation you were referencing today that she was a part of with another senator in Roseville who's also interacted with our department. And I saw the Birth Justice Collaborative as the recipient of the legislation that she was a part of writing. Went on to, did a Google, right? Birth Justice Collaborative, what is that? Be curious as you engage the news. And I followed it, saw who their director was, reached out, and was like, I would really love to know more about this. Like, I feel like this is something our students need to learn about, be engaged in. I would love to learn more about this, be engaged. And then come find out I live like 4 blocks from Corenia, right? But that's another story. But it's more like I just really want to impress on you to like be engaged in what's happening around us, right? Your students, you're busy, super busy, I get it. So make it easy on yourselves, right? Follow the different feeds in your social media so the news just populates. 85% of the time I scroll right past the headlines. They don't relate to me or I'm not interested, but occasionally a headline's going to pop up and I'm like, that's something I need to know about. That's something I need to be aware of. Same for you. Go in and read it. And then, persist through any of that internal dialogue that might say, nobody cares about me. I'm 19 years old. I'm 20 years old. I'm a middle-aged white dude, right? Like, whatever the case may be, like fight through that internal dialogue. And the worst that could happen is I don't get a response and I didn't know Corenia before anyway. So the worst that happens is I still don't know her, right? But like what could happen is amazing connection, amazing collaboration. You never know what doors begin to open for you, who you get introduced to, what ideas come to your world, what ideas you can bring to somebody else's world. So I don't say stay in touch with the news just for like my health. Like I'm definitely in touch with the news and I follow up and I engage. But for you all, like definitely like do that. Stay in touch. Multiple speakers have invited that and have welcomed that. And again, some of the speakers may intersect with some of your interests and where you're going, some of your lived experiences. Some of them may not relate. But definitely pull on those invited threads that people are throwing out to you. And who knows where that goes from here. Especially at this stage in your life when you are trying to try out certain things. If you're interested in policy, spend some time with people who are doing policy and either confirm that little prompting in your life going, yeah, maybe policy, or go, yeah, I don't know what I was thinking. That definitely is not my gig, and shut that file up and put it away. But that's how you're gonna know, right? Start meeting people, start working with them. Kaylin, who is here, I know she has interest in working with mothers and young children, and so I'm gonna encourage her to reach out and just kind of connect with you. Is that something, or do I have a different idea about what that looks like? So
Absolutely.
follow up with people,
Let's
okay?
do.
Build relationships, and see
And
where
I'd
that
say
goes.
one other thing too,
Yeah.
which is like, take advantage of being in school. It is a time where people are so excited to help you because you're learning and you're growing. And it's nothing like when you're actually out of school and you're in the workforce and you're just doing your thing. Those opportunities are a little bit less. Or they look a little different. Take advantage while you're at school, reach out, especially if you're doing internships and things like that. Always happy to be a bridge and make warm connections to other things that you're interested in. I live a very intersectional life, so it's not all about moms and babies. There's a lot of other focus areas. So yeah, do reach out if I can ever be of help.
All right, I know Stacy had thrown her hand up.
First of all, I just love the name of your organization.
Thank you.
And just everything, the colors, everything. I just want to say, I just appreciate how holistic and inclusive and mindful Wholesome Management is, and I just wanted to thank you for that. This could have been, I was thinking of the stories I've heard and how helpful this organization would have been so back then as well. So this is really needed, and just thank you for the work.
Thank you. Thanks for the work that you all are doing and will continue to do. Yeah. Thanks, y'all.
All right, thanks, Corenia.